Hi, my name is Charlene Doolam. Um, today my presentation is about macro practice analysis of Black women as a population within the community served by my internship at Matsu Regional Medical Center. Um, so we know that to effectively create macro level change, social workers have to understand the population affected, the problems they face, and then the arena in which the change will occur, or that we want the change to occur. So the framework is referred to by the text and as social workers as the macro practice conceptual framework. Um, and there's a big emphasis on understanding the intersections between problem, population, and arena. Um, so in the Matsu Valley and in at Matsu Regional Medical Center, um, are when we look at the physical dimensions of the geography, the environment, the Matsu Valley is a really big place. Um, It's roughly the size of West Virginia. If driving from one end, because there is a road, you can drive from one end to the other, and it's a good 12-hour drive in good weather. So it's very big. And there's a lot of small cities, and then there's lots of rural cities or rural areas that don't necessarily have enough of a population to have a city. So they become like little towns or sometimes we call them villages. Um, so there's huge barriers to getting care, transportation. Like the distance between the communities. There's also a good chunk um, of our time. There's severe winter weather conditions. And then some of our areas are not, you can't get to them by a road. It's either boat or plane. So there's a lot of barriers to care. Um, Matsu Regional Medical Center they function kind of as a hub for healthcare services. Um, we do emergency care, inpatient services, behavioral health treatment. Um, and it's for the residents throughout this whole region. They've got one big building. It was just the one that I was interning at, and they have I think four or five small little offices throughout the more rural communities, so that you don't have to come all the way into the hospital to access the smaller emergencies, and then also they're able to medevac to the hospital from those smaller locations. Um, so um, our Our book defines like the social dimensions and the social relationships um, with by there are traditional cultural traditions, social networks, familial relationships, um, and other informal relationships like friendships and coworker type relationships. Are in the Matsu, we have a really diverse population. Anchorage is our closest neighboring city, and it's one of the most diverse populations per capita in the United States. We have, of course, our Alaska Native residents who typically are affiliated with one or more of the um, tribes in the Matsu Valley. We have a lot of military families. Anchorage has an Air Force base and an Army base, and Anchorage is a bowl. It's surrounded by mountains, and then everybody kind of lives in the basin of that. and it limits housing. So a lot of the military families are pushed out to the Matsu Valley. And so we have those families. We have a lot of, um, is it like transient? And I don't mean like homeless. I mean people who come up here for the summer. So they come up here specifically for construction or specifically for fishing, and then return back to their home communities. And then we also have a community of, so people who travel for the oil industry. And so they may only live in Alaska for certain months out of the year, or some of it's 2 weeks on, 2 weeks off. That we have a good chunk of the population who lives like that. Um, they're here for 2 weeks and they go home for 2 weeks. Um, so the population that I wanted to talk about, and that I feel like has a lot of important needs. So many populations do, but I wanted to talk about Black women and the struggles that they face in our community, and specifically while at my internship at Matsu Regional Medical Center. Um, so as we know, you know, from a lot of sources, through that we know that Black women um, have really high infant mortality rate or maternal mortality rates, also infant mortality rates, but they struggle to be believed, to get care um, in our medical systems, and that's throughout the United States. Bell Hook, Bell Hooks is a famous feminist writer who has several books and so many writings about how Black women at that intersection of race and gender and social structure um, are on the lowest rung, or at the most have the most intersections, the most things that impact them negatively. Um, so it impacts their ability to access resources, to access healthcare, to their social positioning. Um, so, and while they historically have occupied the marginalized positions in both that racial and gender hierarchy, they also play central roles in community leadership and social justice environments. And that is also true here in the Matsu Valley. Um, Black women are incredible, and they are the backbone of so many of our programs here. Um, I interviewed um, a couple of ladies that I work with, and so uh, some of the problems that they discussed. So the health disparities. So Jay Lee talked about how, she is a clinician in the community. She volunteers with the NAACP. She also has some health issues, and it is so hard for her to find a doctor who understands her, not understands and believes her. There's a lot of doctors who are just like, sure, and they don't offer solutions. Um, and uh, or they just flat out don't believe her. She has been accused of drug seeking. A girl has never been on drugs in her life. She is so driven and so incredibly smart. And she doesn't look, she's beautiful. And so, and in so many ways. And so for her to talk to a doctor who, doesn't believe her pain, doesn't believe her symptoms, is really hard for her. Um, one of the other Black women that I talked to, her name is Andrea. She is also a clinician. She works at the hospital, and she's discussed how that when there is a Black female patient, the providers, the psychologists and psychiatrists on staff will question their symptoms. Do we really think that they're psychotic? Do we think that they're drug seeking? Do we really think they're, suicidal? Um, and it's not something that any other population experiences on this level. And it's shocking and concerning. Um, and Andrea does such a good job of I've watched her work with clients, helping them navigate the system of convincing a doctor that you are telling them the truth, convincing them that your pain and your what, for example, there was a young lady who the certain foods make her feel very sick. And so she was restricting her food and trying to only eat things that didn't make her sick. And this is something that the hospital accommodates all the time. It's you pick from a menu of the foods that you want. But the provider, the doctor, was questioning whether this was attention seeking, whether these foods really did make her sick. Um, and, we really had to advocate that if she doesn't want to feel this way, this is something that's happening to her. Um, and then also, I spoke with a coworker named Princess, and she is also an amazing clinician here in the Matsu Valley. And she talked about the struggle of accessing competent healthcare and people understanding her symptoms versus somebody else's symptoms, and the racism that's baked into our medical care system. And like there's different parameters for Black people than white people when um that's not appropriate, and it's not based on fact, it's based on racism. um she talked with me about one of the books that she loves that's called Even the Rats Were White. And it's a book about medical care in America and how the systemic racism affects people. I am, I feel like I'm running out of time. So I do want to talk about community values and strengths. Um, so, despite the systemic challenges that the women of color face, they demonstrate significant strengths and resilience. They are incredibly um, resilient overall. They typically have strong family kinship networks, spiritual or faith-based support systems. There's a lot of cultural pride and identity, lots of leadership and community advocacy. And we know historically women have played incredibly important roles in the civil rights movement, community activism, and social justice. Um, let's see. I know so politically, here in Alaska, we have, and of course, there's like the Congressional Black Caucus for that's, for um, the American persons of color. We do have like our NAACP, we have lots of advocates. There's uh, some of the policies that they are working on is addressing that healthcare inequality, talking about maternal health and economic justice. Um, we have a lot of informal leaders here. Like I said, the clinicians that I work with, They are activists in the community. They work with the NAACP. They're advocates with the MMIP, missing, murdered, and indigenous persons. Um, there's so many policies that they're working on. So the Medicaid expansion and is one. We in Alaska, we worked really hard for a rural expansion to get care to our rural communities. And so we were awarded $158 million for that, which when you think of healthcare, $158 million doesn't seem huge, but it really is huge for Alaska. We're working on the maternal health initiatives under that package so that the uh, the healthcare providers can get maternal health care to the women in the remote areas, and then also helping them access um, the actual hospital for their births, and especially with high risk births and getting those services delivered to them or getting them into specialists if they need that. Um, some of our the so our community structure and capacity. Oh, I might have needed more than 20 minutes. Um, Formal resources available to Black women include the hospital, of course. There's several organizations that have mental health services. There are many nonprofit organizations, one of which I work for. There are advocacy groups focused on racial and gender equality and equity. But and then of course we have our informal resources again, which is our grassroots organizations, our peer support network, our faith communities, and our family networks. Um, in Alaska, the healthcare and social services often operate through collaborative networks. So the hospitals collaborate with the community agencies and the nonprofit organizations to get the needs met of everybody. Um, our hospital, we do a lot of collaboration with the small communities that where the people are from. So sometimes they are flown in, sometimes they're able to drive in, but we have to collaborate with the communities where they're going and how do we partner with them to get them stable housing, to get them their medications. Um, and all the resources that they need to remain healthy. And then also having those conversations of do they need to move to town in order to maintain their mental health? And sometimes that does happen. And then how do we help build them community once they have made that decision? Um, So one of the key issues or the key issue really that I've been talking about is the issue that, Black women within the healthcare system and their limited access to the culturally responsive mental health issue. And I think that's one of the driving factors of why the three women that I interviewed have gone into social work to be clinicians, um, to kind of address some of these things so that they can provide um, other people and other women who need this kind of support. They can address the the cultural competency of the issues and the providers. Um, they can address the limited representation of mental health professionals. Um, they can address the stigma around mental health treatment. Um, so the I know I'm at the 20-minute mark. I researching this topic has been amazing. I feel like I have so much more to learn. Um, there's so much healing and empowerment required um, to, or there's so much healing and empowerment that I'm learning, that I'm gaining from looking at the women near me and around me and the work that they're doing and the changes they're making. Um, and the way that they advocate politically, and then also locally within my internship. Um, and they are working not only on the micro level, but on the macro level. And I am honored to be learning this and trying to understand those complex relationships between communities, the populations, and the social problems, and then how do we um, look at the challenges and the strengths within the community so that we can, um, collaborate for systemic change. Um, so this class is amazing about looking at the culturally responsive practices, the community engagement, the political advocacy that social workers can do to help address these structural barriers and promote equity in the healthcare system. So thank you so much.